school here in Ventura County, and I'm working with Select Home Care, kind of overseeing care with Katie, setting up evaluations, following through the plan of care, and seeing that our clients or patients are being well managed, their care is being well managed. Now, this is called warning signs, so I'm going to really go through what you can look for in your patients or clients and things to take note of and to report. So we aren't doctors. We may not know why these things are happening, but we're observing them happening, and it's important we know when we need to call 911 if it's an urgent or an emergency, or when we can call the office to let Katie or Megan or myself know here's what's going on, so that we can then report that information to the family or parties involved in that patient's or client's care, and they can do what they need with that information. So going into that, it's important that you know your clients. Now, some of you might only be there a couple times a week, sometimes even only a couple hours per day. Others are there 24 hours a day, so you're with this person all the time. You know their routine, you know physically what they do, you know what they like to do, you know what they like to eat, how often they eat. Sometimes you even know the more personal things, you know their bowel patterns, you know how often they're urinating, things like that. And all these are important to take into consideration, because you need to know your normal. You need to have a base to decide if something is changing in that patient. So we're gonna start. I wanna just also say with this that it's important that you always listen to your clients, okay? So whether they have dementia or Alzheimer's, hear them, because what they're saying could be the first key factor to knowing what's going on. So if they're saying they have pain, if they're saying their stomach's hurting, if they're telling you I haven't gone to the bathroom in 5 days, listen to them and call us and let us know. You know, some of this is common sense. So you're sitting there day to day taking care of them, and you might get that uneasy feeling like this doesn't seem right. You know, something's a little off. And the best thing to do if you're unsure is to call the office, you know, and ask. It doesn't hurt to ask. Let them know what's going on, and we can kind of guide you through and ask more questions to find out exactly what we need to know. Okay, so I'm going to start with some physical changes that can occur in the body, and I'm going to start kind of neurologically, and that means more with the brain, the mental state as well. So some things you want to know is, how oriented are your clients? How alert are they? Do they know what's going on around them? Do they know who they are? Do they know who you are? Do they recognize family members? Do they know the date, the time? Do they know where they are? If they know these things, and then one day you come in and they have no idea where they are, obviously that's cause for concern. Something that they're altering their orientation. It's not the same as it was the day before. Now, if they're always confused, this is a tricky one, because with dementia and Alzheimer's, there's different levels. Okay, so from very minimal or mild to extreme dementia. And if you have someone who's on the lower end of that scale, who might be mildly confused from day to day, but they still know where they are, they know this is their home, and then again, like I said, one day they don't. They're very agitated, they have no idea where they are, that would be cause for concern. But don't rule things out just because someone has dementia. If it's a change from anything that's normal, take it into consideration. Okay, obviously if they're completely oriented, they are fully functioning, you're able to carry on a conversation consistently with them always, and one day you come in and none of that is the same, that's cause for concern, and should be reported to us, to Katie, the office, Megan, any of us, so we can let the family members know. So some things you also want to look out for is in communication. So when communicating with this person, how do they communicate? Can they speak? Can they tell you what they need, what their needs are? And do they understand you speaking to them, telling them what you need from them or what you need them to do? Can you carry on the conversation? If suddenly one day they're having trouble speaking, suddenly one day they cannot carry on a conversation, we need to know about that. I just want to stop and give a little note. This is going to seem kind of repetitive in what I'm saying. I'm going to often say this will be a time to report. You're going to hear the word change a lot. And then sudden as well. A key word is sudden. When things suddenly change, that's a cause for concern. So just keep that in mind when I'm finishing this out. Any trouble seeing, so either in one or both eyes, if they haven't had trouble seeing before, if they've had, fine vision, they use glasses, all of a sudden they're telling you that, it's black, or they're not, seeing anything in the room, we need to know about that. Dizziness, loss of balance or coordination, using motor skills as well. So if one day they can pick up a pen like this perfectly fine, the next day they're stumbling to pick it up, that's something we need to know about. It's gonna, it's presenting, it's showing that whatever's going on is progressing, and it's something we need to know about. Some of these things are highly important, and if you'll see, there's a little sheet here, half sheet. These are certain things can be indicators of a stroke, which is something that if you see certain signs, it's best that you call 911 first before calling us. And that would be, if they're having confusion or trouble speaking, slurred speech, if one side of the face is drooping or either side of the face is drooping, this can signify a stroke, okay? If there's tingling in the extremities or either side of the body, this would be cause to call 911, okay? If you see any of those symptoms, especially combined together.